This segment is sponsored by the Endoscopic Weight Loss Center of America. As September comes to a close, it's time to start thinking about the holidays. And well, that can mean excess eating and maybe some weight gain. But we want you to lose weight this holiday season by changing your lifestyle with the Endoscopic Weight Loss Center of America. I spoke with Dr. Allen Blosser about how his team can help you do just that. Dr. Blosser, so good to see you again. Welcome back.
It is my privilege. Thank you so much for having me.
Okay, we're heading into a new season, right? We've all been hunkered down. People are maybe taking a closer look at their health and when it comes to their weight. You say that there's some new information out there regarding weight loss and diabetes. What can you share with us?
Yes, there was a recently published article in the New England Journal within the last couple of weeks where they compared bariatric surgery to just weight loss alone. And they found that the weight loss was the critical element with reversing not only non-insulin dependent, but insulin dependent diabetes and getting those patients who were obese and heading towards insulin dependent diabetes and heading towards complications of those diabetes, that the weight loss was, whether it was done bariatrically or whether it was done on their own, was the key element. So now the shift in focus is not from surgery, but to lesser invasive means of helping these patients who are morbidly obese with BMIs greater than 30 to get that weight off of them so that they do not suffer the consequences of obesity.
And you've said that with bariatric surgery, there are people that want to get it, that want to lose weight, but it was too dangerous for them because it was so invasive. So now these new techniques that you use and all these techniques that are coming out are applicable to more people.
Absolutely correct. The 95% of people who are actually candidates for bariatric surgery don't get it because of the risk and potential complications of surgery, not including the cost. So now with this New England Journal of Medicine article, we're focusing on the lesser invasive, i.e. endoscopic approaches, that we can focus on balloons. We can focus on what is called endoscopic sleeve gastroplex, and we can focus on patients who've already had either definitive surgery with a Roux-en-Y gastric bypass or a sleeve gastroplex to actually go in and revise and redo their surgical anastomoses to get them back to where they were when they originally had surgery. So the lesser invasive endoscopic approaches are now going to become much more favorable than the surgical approaches.
You do the Obera balloon. What is that procedure like? What does that do for somebody?
It's a balloon that's water filled, acts as a tool to help slow down gastric emptying and retrain the brain with regards to how you feel when you eat, and we adjust the diet accordingly. It's placed during a simple endoscopy, so you'll be anesthetized by an anesthesiologist. I take a little flexible tube, insert it into your mouth, down your esophagus, into your stomach, where I deploy the balloon in one setting and then remove the balloon at 6 or 9 months later. And during that period of time, most patients will lose in excess of 40 pounds. We've had many patients lose in excess of 100 pounds, come off their blood pressure medications, come off their diabetes medications, and get back to the life that they had long sought.
And this is FDA approved?
It is FDA.
Yeah.
Yes, all the equipment, all the procedures are FDA approved. They're made by Apollo Endosurgery. The Orbera balloon and the Overstitch SX endosurgery devices are what we use.
And with endoscopy, the good thing is the lack of or the minimal recovery time, right?
That is correct. These are same-day procedures, so the Orbera balloon literally takes less than 10 minutes to either deploy in the stomach or remove. The ESG or the stomal revisions take about a half hour to 45 minutes. They're all in and out same-day upper endoscopy procedures, so you come into the facility at 8 o'clock, you get your procedure at 9 o'clock, and you're home by 10 o'clock. So the downtime is really a key element to this. There's no hospital admissions. And the risk of complications, i.e. major complications, bleeding or perforating or complications from anesthesia, are minimal, less than 1 in 10,000 as compared to that of general abdominal surgery.
Now, what are some of the other ways that you help patients lose weight? What are some of the other procedures you do?
Well, as I discussed earlier, the ESG, which is the sleeve gastroplex, is a device using the Overstitch device where we actually fold the stomach in half, if not more. So I can reduce your stomach volume from the size of a soccer ball or football down to the size of a baseball. So the gastric reduction is about 50 to 75% in volume. The other device or the other procedure is called a stomal revision. And this is for patients who've had definitive surgery, i.e. a Roux-en-Y gastric bypass or a sleeve, laparoscopic sleeve gastrectomy. And I can redo their surgical anastomosis or their surgical connections or their gastric volume, reduce it down even further so that the weight loss that they exhibited after surgery, immediately after surgery, they can be restored to that now that they've gained it back over the 5 or 10 years since their surgery.
It's amazing, the advancement of technology and medicine and how you are able to help everybody. Dr. Blosser, so good to see you. Thanks for sharing with us today.
It is my privilege. Thank you for having me on. Good to see you again.
For more information on how to start your new fall weight loss routine and lifestyle, give the Endoscopic Weight Loss Center a call at 703-389-3364 or go to EWLCA.com.